Hello, this is Dr. Kingston, and in this video, we are going to be talking about the cranial fossae. Our big objectives here are simply to identify what makes the anterior, middle, and posterior cranial fossa, and then we're going to take a look at what sort of passageways they have through them and what sort of structures are passing through them. All right, let's start off just by demarcating our fossae and their borders. Now, what's not always obvious from these photos is that these are arranged kind of like steps. So the anterior cranial fossa is the top step, middle is one step down, and the posterior fossa is the bottom step or the landing. So these borders between them where you see color shifts actually have height differences between them, and that will become more obvious to you as you interact with the skull models in the lab. For now, though, let's name some borders. All right, so the anterior cranial fossa extends from the frontal bones all the way posteriorly to the lesser wing of the sphenoid. And that is going to include the ethmoid bone in the middle there as part of its floor. The middle cranial fossa then goes from that lesser wing of the sphenoid all the way posterior to the petrous portion of the temporal bone. That's that very thick portion that houses the middle and inner ear. This means that it's going to include the greater wing of the sphenoid and portions of the parietal and temporal bones as its floor and walls. And finally, the posterior cranial fossa is everything beyond that petrous portion posteriorly. Most of its floor and walls are made up by the occipital bone. This anterior wall here right at the border of the middle and posterior is actually a wall. It's hard to decipher in this image, but this is actually straight up and down here. So we've got the petrous portion kind of acting as a little bit of an anterior wall, but most of our floor is going to be occipital bone. So with our borders defined now, let's take a little bit closer look at the contents of each fossa. The anterior cranial fossa is primarily a home for the frontal lobe of the brain. So those lobes that are in here are right here. In addition, the olfactory bulb and its tracts travel along the floor of the anterior cranial fossa. And they will reach the cribriform plate here, so all these little holes here. The olfactory bulbs sit directly over the top here and then send their little filaments down into the nasal cavity, and those will transmit olfaction or smell back to the brain. And that is really all that's going on up here. So let's move down into our middle fossa. There is considerably more going on in the middle cranial fossa. Again, most of the floor here is going to be home to the brain. This time it's the temporal lobes that sit here on the lateral aspects, and then the pituitary gland. So we got temporal lobes here, and then the pituitary gland sitting here centrally in the sella turcica of the sphenoid. We also have a number of blood vessels that traverse this area. So we've got the internal carotid entering here, and then it kind of curls up and around this way. It also gives off its ophthalmic branch here, which is going to travel out through these optic canals here, along with the optic nerve. The middle meningeal artery is going to enter into the cranium here. And finally, we've got the cavernous sinus, which takes up space on the walls of the greater wing of the sphenoid here. Okay, so these sit almost over the top of all of these holes. All right, and if that were not enough, we've got cranial nerves 2 through 6 originating from the brainstem here and traveling through and exiting the crania through the various foramina in the floor of this fossa. Now, this is a lot, and I don't want to scare you. So let's break these structures and features down by what they're doing and where they're going instead of just trying to memorize them. All right, the middle cranial fossa is very, very closely related to the orbit. It sits directly posterior to it. So orbit is here, middle cranial fossa is here. So it's not a huge surprise that it has a lot of communication with the orbit, both with passageways and with structures traveling in between them. Right, two passageways exist to get between the middle cranial fossa and the orbit. The first is this optic canal here, okay? And the optic canal is definitely the more specialized of the two. It's going to transmit the optic nerve between the orbit and cranial cavity along with the ophthalmic artery, and that is it. Everything else passing into the orbit has to travel through the superior orbital fissure. And the superior orbital fissure is not really well defined in this picture here, but it sits roughly here and here. You can see it pretty well on this picture here outlined in yellow. All right, it is a big foramen, not even really a foramen, it's a fissure. It's a big gap in the bones that a lot of structures travel through to get between that middle cranial fossa and the orbit. Okay, this is going to include cranial nerves 3, 4, 6, the ophthalmic division of 5, and the ophthalmic veins. All right, so numerous structures traveling through there, and that's why it's so big. The middle cranial fossa also communicates with the regions that sit directly inferior to it. So these are the pterygopalatine fossa anteriorly, and then the infratemporal fossa more posterior. The maxillary nerve will pass through the foramen rotundum to reach the pterygopalatine fossa, and that's that. The infratemporal fossa has a little bit more going on because this is where all of your jaw muscles are located, and it's right at the junction of your anterior neck and the cranium. So here we've got the mandibular nerve and lesser petrosal nerve passing through foramen ovale to get into the infratemporal fossa. We've got some blood vessels leaving the infratemporal fossa to supply structures in the cranium as well. So we've got the middle meningeal artery enters in through the foramen spinosum. All right, foramen spinosum is this little guy who kind of looks like a heel print if you consider foramen ovale to be the rest of the shoe. So here's the toe plate, there's the heel. And then also here, we have the internal carotid artery entering the cranium through the carotid canal. The posterior cranial fossa is similarly busy. This is the home of the cerebellum and the brainstem, and it also houses a number of the blood vessels that supply the posterior brain. So we've got the vertebral arteries that enter in through the foramen magnum here and join together to form the basal artery that kind of climbs right up this way. We also have the formation of the jugular vein occurring in this portion of the skull. And you can see the jugular foramen here. It forms this big gap between the petrous portion of the temporal and the occipital bone here. We also have a number of cranial nerves traveling through this area again. This time it's 7 through 12. But the nice thing about this is that they really only go to one of two places. Cranial nerves 7 and 8 enter into the internal acoustic meatus, which communicates with the middle ear and the internal ear. And almost everything else heads out one of three exits down into the neck. So the internal jugular veins, along with cranial nerves 9, 10, and 11, exit through the jugular foramen. So again, this big gap here. Cranial nerve 11 is a little bit weird, though. We call it a cranial nerve, but it has spinal roots, so roots coming off the spinal cord. So before it can exit the jugular foramen, it first has to enter into the cranial cavity through the foramen magnum. So it does this along with the spinal cord and the vertebral arteries, comes up here and then exits out there. And finally, the hypoglossal nerve exits through the hypoglossal foramen, which is right here on the occipital bone, right down near the occipital condyles that articulate with the vertebral column. And that is everything for these cranial fossae. For your review question, I would like you to answer, Which cranial fossa communicates with the orbit? And the correct answer here is the middle cranial fossa. So remember, the anterior cranial fossa had a small communication down into the nasal cavity. The middle cranial fossa communicates with the orbit, the pterygopalatine fossa and the infratemporal fossa. And the posterior cranial fossa communicates with the ear and with the neck.